Feeling dizzy, headachy, neck pain, and no one can tell you why? You may be having what's called cervicogenic dizziness or cervicogenic headaches. My name is Mauro with Physio Tips with Mauro, and welcome to day 1 of our 7-day Cervicogenic Relief Challenge, where we're going to tackle dizziness and headaches at the source, the cervical spine. Cervicogenic dizziness is caused by dysfunction in the upper neck, especially where the head and spine meet. This area is packed with proprioceptors, tiny sensors that tell your brain where your head is in space. When those sensors are off from poor posture, whiplash, injury, or weakness, it can confuse your balance system and cause dizziness. The symptoms are tricky. You may not feel like the room is spinning like true vertigo, but more like lightheadedness, unsteadiness, feeling off balance, especially when you're turning your head, brain fog, or pressure behind the eyes. And here's the kicker. Your MRI might look normal. Your X-ray might look normal. That's because it's not a bone or disc problem. It's a neuromuscular control issue. And the good news is, it's fixable. For ruling in cervicogenic dizziness, let's start with the subjective exam features that we might find in someone that has cervicogenic dizziness. The first thing that I like to talk about is loss of hearing. If you've suddenly had dizziness and also had a loss of hearing that correlated with that same time as your onset, this may be something other than cervicogenic dizziness. For cervicogenic dizziness, usually this is a dizziness that comes on that does not have an obvious ear infection or hearing loss or some other type of brain injury when you get your dizziness. Pain in the upper neck commonly can cause headaches. So if you notice you're suffering 2, 3, 4 headaches a week and it started pretty around the same time that you started having dizziness, that is an important feature right there, because that would be kind of more classical with cervicogenic dizziness. Now, some of my patients, all of them have headaches and dizziness. Some might have headaches, some might have dizziness, some might have nausea. The upper neck can even trigger a TMJ type pain that can radiate down. But if you do notice you have several of those boxes checked, yes, I do get headaches sometimes, yes, I do get dizziness, yes, I do have obvious neck pain, those are the classic subjective features of cervicogenic dizziness. Another feature that we could look at is true vertigo usually lasts 30 seconds to a minute and it starts to subside with a severe spinning sensation. For cervicogenic dizziness, you might feel more of I just feel off, I feel a little off balanced. If I get up suddenly, I feel a little bit dizzy or off balanced. But these symptoms could come off and on all day long. It's not just a 30-second episode. So this can persist for minutes to hours to days to months. It can be very chronic, it can be pretty debilitating. So those are some subjective features that we might expect with cervicogenic dizziness. Over my 24-year career, I worked with so many patients that were told that their symptoms were just stress, anxiety, it was all in their head. In actuality, it was coming from their head and especially from their neck. That's why I've created this series, to guide you step by step with clear and effective exercises that really make a difference. Over the next 6 episodes, I'm going to show you how to restore proper neck function with gentle self-mobilizations, muscle activation, balance drills, eye-head retraining, etc. So stay with me, because in day 2, that's when the physical relief begins. So don't forget to subscribe to this channel and turn on your notifications so you don't miss episode 2 of this series. And if you think your dizziness and your headaches are coming from your neck, in the comment below write, "That's me." I would love to hear your story. Well, that's it for today's episode. Can't wait to see you on episode 2. Until then, it's goodbye for now, and we'll see you next time.